I'll do a little introduction. It's such a pleasure, and I know you just must be rushing from A to B, so I'll try to keep this brief. Dr. Eric Hoskins was first elected as the MPP for Toronto riding of St. Paul's in 2009. He was appointed as Minister of Health and Long-Term Care in June of 2014 and had previously served as the Minister of Economic Development, Trade and Employment, the Minister of Children and Youth Services, and Minister of Citizenship and Immigration. Eric is a renowned humanitarian, absolutely, for which well, I'll show my own bias, but a renowned humanitarian, a family doctor, a husband, and a father, all very important roles. And a proud Ontarian with a long and dedicated record of public service. So without further ado, I'd like to welcome you, Dr. Hoskins, to the microphone.
Well, good afternoon, everyone. It's just like in the restaurant this morning. It was hot in there. It's pretty warm in here as well. So if you have to get up and move around or shuffle, that's okay. And the last comment as well about your MPP, was that during question period, the MPP on the BlackBerry and heckling, that comment? I hope I'm not your MPP. Although if I'm on my BlackBerry during question period, it's usually because I'm trying to anticipate who's going to be firing a question at me or getting an answer to a question that I think is going to come my way. But what's that? He was on Twitter. Okay, that's not good. But ladies and gentlemen, thank you for being here today. This is what, your 17th RNAO Queen's Park Day. And I've said this so many times that, and I'd appreciate it if you sort of keep it close to yourselves, but since becoming health minister 2.5 years ago, I have not met an association, an advocacy group that is as exceptional as RNAO. And I mean that. Speaking of Twitter, don't tweet that. But especially not to the OMA, somebody just said. But I honestly mean that the leadership that exists within RNAO, the talent, how your advocacy and your decisions are so strongly rooted in good policy, public policy. How you, as an association, you do the hard work first to have confidence that what you're putting forward is evidence-based, that it sort of captures those critically important areas that aren't talked about nearly enough, like health equity and social determinants of health. And how I haven't found yet a suggestion and a number of criticisms as well, which were well-founded, but I haven't found an idea or a suggestion coming forward from RNAO that I haven't agreed with. And so it's made it, in some respects, much easier to work with your organization. Doesn't mean that there haven't been tremendous challenges in making progress. The beginnings of I would refer to it almost like a down payment last year, where we announced, I think, $85 million in the spring budget to go towards compensation primarily for nurse practitioners, individuals that have gone many years without having seen any significant increase in their compensation, despite the incredibly important role that they play in delivering health services. So there are challenges, particularly, and that's a good one, I think, to reference in this fiscal environment. But know that I believe and I know and I hear you that much, much more needs to be done. So, you know, I've got about 7 pages here that just refer to Doris. I think the Premier was clear for those of you who were at breakfast. And it's not, you know, it's Doris and Carol and so many others that I've had the honor of getting to know over the past number of years. I think Doris, our first interaction might have been on medical tourism, right? And we saw completely eye to eye on that issue and took steps to effectively ban medical tourism in the province. And really since that time, those of you, and probably all of you know Doris as well, know just how strong an advocate she is for your profession, but even more so, I would argue, for Ontarians and for healthcare and for the public good. So she's been doing this for 20 years now, and surrounded by remarkable individuals that collectively, I think, have allowed you to be part of an association that truly has made a difference in healthcare in this province. So keep that up. Keep putting my feet to the fire, being critical of our decisions or anticipated decisions or considerations, because we need to have your good advice. And that's what we've been doing. That's what I've been doing over the last 2.5 years. It provides us with an opportunity, and if you don't know, my background is in public health. I'm a public health doctor. And that has, I think, given us an opportunity to share those principles that I talked about earlier. I believe as strongly as you do in the principles of health equity, in the reality of the social determinants of health, and where our investments outside of healthcare but related to healthcare outcomes are so vitally important. And I have a good understanding of population health and how we need to open our eyes to, when we think of investing in healthcare, what that might mean. So, you know, back, I don't know, 50 years ago, almost 40 years ago, when my sister first said that she wanted to become a nurse, and then she went to, Victoria College in London to get her nursing degree. That was sort of how I understood the nursing profession, of her aspiration, and mostly actually her leaving home to go to college and do the training and education that was necessary. But it's remarkable when I think how much my perception of nursing has changed over the last number of decades. Frankly, society's perception of nursing, right? And the role of nursing. My understanding sort of matured as I went through medical school at McMaster, which fortunately, and I wish this was more often the case, where I was instilled with those truest values of the team, that there's nothing special about any one of us. What's special is when all of us as healthcare professionals are able to work together as a team, understanding that we all have an equally important role to play in delivering healthcare to Ontarians. And then, holy cow, when I became health minister, you know, my eyes were opened even further. And I think more than anything else, to understand the work that still needed to be done. And that kind of gets me back to the beginning, you know, and RNAO and others that have provided me with a very logical pathway that will result in better health outcomes for Ontarians involving our nurses. So there's a few things, as you know, that we've been working on. This is where I've got to go through the Doris accolades and get back to a few of these points, but the issue, and an issue that's been important for you, those of you particularly who are RNs, has been the issue of RN prescribing. And it is an issue that's important to me, and I want to thank you for the advice that I've received and this government has received. It's something that we committed to doing in last year's budget, something that the Premier herself felt so strongly about that she added it and inserted it into my mandate letter that I received, a renewed mandate letter last fall. So, and this shouldn't come to any surprise as anyone, but I'm pleased to announce, and I think I can provide a little bit more detail at this point, I'm pleased to announce that I will be bringing forward very shortly proposed amendments to the Nursing Act to implement. I'm not, you don't know what those amendments are yet. You better, I'd suggest you hold your applause till you actually know what the amendments are going to say. And I know there's some critically important words, right? And, but I will be bringing forward this spring, and it feels like we're already in it today. Hopefully that lingers. Bringing forward proposed amendments, and they're proposed because we need to go through the legislative process, obviously, to the Nursing Act to implement independent prescribing, authorizing RNs to prescribe drugs, as well as, which is kind of self-evident, to communicate a diagnosis for the purpose of prescribing. And as I mentioned, well, you should, and I know you're applauding yourself on this because it really, you know, I've had an important, but, you know, just one part to play in this. So really, I hope and I suspect you're applauding yourselves as much because this is such an important but natural evolution of your profession. And as I mentioned, I anticipate introducing these proposed amendments this spring. The next step will be once those, but hopefully once those proposed legislative amendments are approved, then the College of Nurses will develop the regulatory framework for prescribing. And I know that this is something that we've been working on for a long time, so we really literally are at that last but important moment. And I also recognize that if and when the amendment is passed, that we also importantly need to make sure that we have the supports and the tools and the mechanisms in place so that RNs get the education and training needed to provide that best possible care that you naturally want to provide for your patients. So we'll look to the College of Nurses to work with us on that aspect, the education and training, what would be most appropriate for nurses, for RNs. So that's one thing that I know was at or near the top of your list. But I also want to take a moment to remind us, while we're on the topic of prescribing, to also update you on where we are and where we stand on expanding the role of nurse practitioners to enable them to prescribe controlled drugs and substances. And we're also very, very close. So a number of months ago, I wrote to the college specifically on this matter, asking them in a responsible and realistic way, but to expedite as much as possible and prioritize this particular aspect of their work so that we could provide nurse practitioners with the opportunity to prescribe controlled drugs and substances. And so, I think I sent that letter perhaps back in October or November, and the College of Nurses prior to, and certainly since that time, have been working diligently on this matter. They began circulating proposed regulation amendments on December 7th. They've approved 2 educational courses to help prepare nurse practitioners to have the necessary competencies to prescribe and manage controlled substances. And consultations on the draft amendments wrapped up a couple of weeks ago, and I'm now looking forward to receiving very, very soon, in fact, probably within the next 2 to 3 weeks, a formal submission and request from the college for approval for the regulations that they put forward. So that is, again, it's a no-brainer, right? Those two issues speak to scope of practice. And those of you who have had the opportunity to talk to me about scope I don't know if those birds are inside or outside, but it's certainly making it feel like spring today, isn't it? And hopefully they haven't just eaten. And see, a few of you understand that as they fly around. So, but anyone who has had the opportunity to talk to me about scope will know that I think this is partly because I'm a healthcare practitioner myself, is that I believe so strongly in enabling all healthcare practitioners to practice to their full abilities and to expand scope so that again, that aspect of the team approach to healthcare, understanding as well that we are a diverse province, we're a large province where different individuals play remarkably different roles depending on where they're situated within the healthcare system and also geographically within the province. So scope expansion allows us, I think, to respect the profession, but also deliver better care. The third thing I wanted to mention as well, and I've just got a couple more, is to talk to you briefly about care coordinators in home and community care. And to talk about the role in primary care. And this is particularly important because, as you know, we've passed the Patients First Act and we are working towards joining our CCACs with our LHINs, which is important for a variety of reasons, but also it gives us a tremendous opportunity. And my vision has always been, I give the example, and there are many of them, of the, say, family doctor working in a family health team with others that sees a woman, maybe 83, 84, maybe she's on her own, and there's an agreement that for the first time she requires some home care. So the current system, which is unwieldy, right, and so tentative, where I would fax through a form to the CCAC, maybe give her a phone number on a sticky as well, and that often would be the last I would hear about that critically important aspect of her care. Unless, during the next visit I took the time and remembered to ask her how that had evolved. But imagine, and this, exists and it needs to exist more, imagine whether it's a community health center or a nurse practitioner-led clinic or a family health team or a myriad of other opportunities. Imagine if instead of giving her that sticky and faxing the form, I just walked down the hall to a care coordinator, or maybe there's a couple depending on the size of the practice or the team, and hand my patient over to the care coordinator who I know, that care coordinator, and she may be funded and employed by the LHIN, but she's embedded in the team. And so I think, to be fair, I think I'm probably borrowing from your policy and what was, RNAO themselves promulgated a number of years ago. So that handoff occurs to a person I know and trust, and I know that she's part of the team, right? She's there, and that's where her office is, and she knows the population of patients, of clients that go to that community health center. And if I'm wondering how my patient is doing and if she successfully was able to get that support she needed at home, I just have to walk down the hall and ask the individual that is part of the team. So my vision and my objective, respecting contracts and collective agreements and individuals' right to be part of a decision-making process in a transition, but to push willing individuals, push isn't even the right word, to enable willing care coordinators and willing recipients to come together and create that reality. And so I think I know we've got that opportunity. So my vision has always been, I think one that's shared with RNAO and hopefully all of you, is to bring care coordination and home care and all that it entails as close to the front line of primary care as we can, and to build those relationships and to have that trust and to enable those activities to take place that will clearly result in a better patient experience. So the last thing that I want to talk about, just as I wrap up, is offloading devices. And I'm a clinician, and a healthcare provider, and so I understand the reality of what happens out there. I was shocked to learn, however, if you look in the northern, I don't know how many of you are from Northern Ontario, but when you look, and when you look at the rates of amputation in the north compared to the rest of the province. When I first learned that about 2 years ago, and I don't know why I hadn't sort of understood that, but as I began to understand as well that there were evidence-based practices and tools and supports well proven in terms of outcomes that we hadn't yet adopted in this province, that for individuals with wounds, particularly infected wounds, or those with the propensity to be infected, that it would make such an obvious and important difference in terms of preventing lost limbs, preventing lost lives, and improving quality of life. So when this, I know that there are other champions in this room. Doris, I don't know if there has been, at least in my estimation, in terms of my experience, any stronger champion of this issue than Doris has been over the last couple of years, where it became so obvious that we needed to evolve our policy and the tools that we had available. So very, very soon, and a number of you already know where we are on this. On the matter of offloading devices, I know that RNAO is in favor of the province publicly funding 3 different forms of offloading devices. You're applauding your own position, which I have to applaud that as well. But so I asked, not that long ago, Health Quality Ontario, together with the Ontario Health Technology Advisory Committee, with an expert panel, to actually look at what those next steps should be. And Health Quality Ontario will very, very shortly be posting draft Ontario Health Technology Advisory Committee recommendations, which those draft recommendations will support funding in this province for those 3 offloading devices. So will benefit from that? Doris has just told me that, where's Al? That Al, you're going to be an individual. This is particularly important to you and relevant to you. And I appreciate you being here. So, to you, Al. So we spent a little bit of time through Health Quality Ontario, getting the best advice, getting the advice of OTAC. Their recommendations, as I mentioned, will very soon be posted for public comment. That is how it proceeds, but that their recommendations will indeed be calling for Ontario to support funding for these devices, the 3 devices that I referenced. And I want you to know today that I accept OTAC's draft recommendations. So that's really why I wanted to come here today. And I'm glad, and it was important to the Premier as well, that she speak to many of you this morning at breakfast and address those of you who are there. So those are, I think, 4 very specific things where we've been able to work together to make progress. A couple of them, we're on the verge. We're not quite there, but I think you'll see this is going to be an important spring where we're going to enable our nurse practitioners to prescribe controlled drugs and substances, where we're going to be able to, we will introduce, and I'm confident that we'll be passing legislation that will enable RNs to independently prescribe. So thank you for listening to me. And I want to just, if there's a couple of pieces of encouragement,
Is that on?
it would be on the issue, which I know is important to you as well. Like, keep pressing anyone who will listen, and even those who will not, at every level, on social determinants of health and on health equity. It's important when we look at the opioid crisis, for example, when we look at how we view mental health, and now we can't have health without mental health, right? And it needs to be seen as 2 sides of the same coin. And on pharmacare as well. It's something that I've been using my position as Minister of Health the best I can to advocate for national pharmacare. We're not there yet. There are others that still need convincing. I believe it's not a fiscal challenge. I believe it's a moral imperative. And it speaks to the heart of that issue of health equity. So your continued advocacy on that issue, as with so many others, will be certainly greatly appreciated by me. So I look forward to continuing to work with RNAO on all of these important initiatives. I know and I love this about you guys, I know that once we lock in these important ones even before, but once it's now time for us to move on to the next as well, right? We can't be satisfied with, as important as these are, we can't be satisfied with these victories. We need to continue to make those changes to our healthcare system that will continue to see those improved outcomes and benefit all Ontarians. Thank you very much.
Thank you, Minister Hoskins. Do you have time for a couple of questions? Just one question? Okay. So, to the mic, Rhonda. The Minister has time for one question.